Good morning, and thank you for joining us for this webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care Division and Fiscal and Administrative Services Division. I'll also note that we have one of our friends from the Nutrition Services Division as well this morning. This webinar is being held on November 13, 2020, and is scheduled to run from 10 a.m. until 11 a.m. We want to thank you for taking some time to join us for this morning's webinar. And good morning again. My name is Steve Profiter, the Director of the Early Learning and Care Division at the California Department of Education. Happy Friday. This is one of the nice things about having this is it's on a Friday. This week was a special week, as on Wednesday, we commemorated a day to honor the veterans that have given so much for this great country. We appreciate all of the sacrifices and selflessness that our people have given to this country. And as we turn back to the webinar, as we have with each webinar, we have a CDE team monitoring questions and working to provide as many answers as possible in real time. Our team is here, as we have been most weeks, to continue to support children, families, and you. This team, whether they're working on this webinar or in their day-to-day work, are committed to this labor of love. I've said it before, and I'll keep saying it. These are some of the greatest and most passionate people I've ever had the privilege to work with. We're all here to support you in the best way we can. And you know, as I think about the work, we celebrated a colleague's retirement this week. And it was nice to reflect on a career dedicated to working towards the best outcomes for children and families. It's a special line of work, and it's not always easy, but it is worth it. Few things are more worthwhile. And as we continue to reflect on where we are in the season, we're thankful at CDE and want to thank all of you as you continue to rise to the challenge in the face of adversity. We know you do it for the love of children and families. We appreciate all of you persisting and working to the best of your abilities to support children and families, regardless of what the pandemic has thrown us in impacted capacities. We want you to know that we see you, we hear you, and we will be here to continue to support you. And with that, I'd like to turn it over to Erica for some opening words.
Thank you, Steve. Erica Otieno, Associate Director. Thank you all for participating. Happy Thanksgiving in advance. Actually, it's 13 days ahead. I'm already thinking about food. Anyway, as you know, the Program Quality Implementation Office, PQI, is responsible for monitoring, training, technical assistance, and contractor support. Two presenters from the office will provide information to you today. Richard Miller, consultant for Orange County and Imperial Counties, will provide an overview of the recently released Management Bulletin 2020, which is about emergency closures not related to COVID-19. Following his presentation, Roseanne Pitts, administrator, will provide information on the upcoming PQI webinar Wednesdays. We are really excited about that. Enjoy this session, and please remember that we appreciate you and all that you do for children and families in your communities. Please continue to reach out to us as needed. We are committed to working together with you. And now on to Virginia.
Thanks so much, Erica, and to everyone that's here. I hope everyone had a good Veterans Day yesterday, or Wednesday, rather. So I'm Virginia Early. I'm the administrator for the policy office. Thank you so much again for being here. We definitely can't do this work without you. For those of you who don't know me, my office is lead over issuing all of the guidance and then working with the legislature and then administration to ensure that priorities and needs from the field are addressed and elevated. So in a little bit, I'll go over some of the ongoing guidance work that we are working on since to sort of continue to update you on where we are since last week. And now on to Alana, our moderator.
Good morning, everyone. I'm Alana Andrade, and I'm a child development consultant in the policy office, and I work under Virginia Early, and I'll continue to be your moderator. And today, helping answer the questions in your Q&A box, we have from the policy office as well, we have Danielle Davis. From the Program Quality Implementation, PQI office, we have Cassandra Lewis, Mai Zhang, Hier Zhang, Rich Miller, Katina Boulay, Serene Yi. And from the Child Development, Nutrition, and Fiscal Services, CDNFS, we have Andrea Johnson, Corey Kahn, and Alan Lynch. From the Child Development Management Information System, CDMIS, we have Robert Halm. And from the Nutrition Services Division, we have Madison Valenz. As Stephen did mention earlier, our team is committed to being as responsive as possible to the questions that we receive. We won't be able to get to all. Nevertheless, we will endeavor to do our best. As always, we will be answering some question aloud at the end of the presentation. If we're unable to answer your question before the end of the hour, all of the questions in the Q&A will still be captured and turned into frequently asked questions, FAQ, on our webpage. In fact, we just posted 30 new questions on our FAQ page. Please take a look. I'll ask Mai to include that webpage link in our chat for you all. Although if you're like me, you probably have that specific page bookmark as a tab on your web browser. So I'll ask Stephen to come back and review our agenda for today.
Thank you, Alana. So we continue to work on guidance as we have been since the signing of this year's budget bills, and even before then. We've released several of those management bulletins, and we continue to work on additional guidance. So we will today provide you with the status of where we are with that guidance work. So you have a sense for where everything is. We'll also be providing updates from the program quality implementation and fiscal teams. As Alana mentioned, we will take questions, and in addition to working through live questions as we're presenting. We'll start with some that have come in through the ELCD emergency email box. And as Alana mentioned, we won't be able to get through all of them, but rest assured, whatever we don't get through, we will take back to address in FAQs on our website. And please use, as Alana mentioned, the Q&A function in Zoom to provide your questions. And now I'm going to move it back to Virginia, who will discuss the ongoing CDE guidance work.
All right, thanks so much, Steve. So we talked last week about, as we talked about our CDE upcoming guidance, about this additional $110 million in coronavirus relief funding, or CRF funds, which the legislature and the governor have identified to address costs and impacts associated with COVID-19. At this point, just to give you an update, the legislature approved the governor's plans, and the governor signed an executive order late last month to get the wheels in motion. Our understanding from this executive order and these letters is that the goal of the funding is to address the continuing impact that COVID-19 has had on waived family fees and on costs for school-age children served. So on the waived family fees portion, there's $30 million to cover the family fees that have been waived in SB 820 for families that are not receiving in-person services. So you may remember SB 820 said, if there aren't additional federal funds, providers will have to absorb the waived fees. And so this $30 million is identified to sort of support the costs of waiving those fees. There's also a piece around costs for school-age children served. So we know that contractors have been serving substantially more school-age children for longer periods of time in subsidized childcare programs due to closures of public schools statewide. And we know that this has caused a shortfall of funds for many providers, and many have considered terminating families. So, a portion of these 110 million will also address those costs. And we know that connected to addressing these costs, that will also help out with our families that are currently enrolled in emergency childcare, because it will be sort of easier to serve them longer and transition them into ongoing care. That's our hope. So at this point, we'd like to leave you with a sort of an update on where we are in our implementation and a key takeaway. So update on where we are in our implementation is that we've been working very closely with the Department of Finance and the administration on the specifics of these funds so that we can begin to move forward. Just want to highlight for folks that CDE has not actually received the money yet. And there's still a number of internal state accounting things that need to be worked out before the money actually gets to CDE's hands. And then, you know, to get the allocations out to all of you. So while we work on obtaining these funds, we're simultaneously working very diligently on guidance related to them. So in terms of the waived family fees, that will mean a revision to Management Bulletin 2019 to clarify guidance. And so the key takeaway for all of you is that because this newly allocated funding would sort of support some of these costs, we're really asking folks not to disenroll children, because if you're over earning your contract due to higher costs related to COVID, please do not disenroll children. Please don't disenroll children that are enrolled in ongoing care with 12-month eligibility. Please do not disenroll children enrolled in emergency child care. We'll be issuing guidance, more guidance on this as we get more details and as we're able to work out some of the pieces that need to be worked out. But we just really want to emphasize that here. If you have any sort of things that are coming up that might make you concerned about various things, please reach out to your fiscal analyst and your program quality implementation regional consultant, who can help you work through any specific details specific to your situation. Of course, we're happy to answer any sort of general questions through our Q&A feature here today. So that's what I have for upcoming guidance to share. We'll continue to share about the 110 million each week as we have more information to share. You can expect more from us in our upcoming sessions. And I will now pass it off to Rich, who will provide our PQI updates on training dates and continued funding applications.
Thank you, Virginia. Good morning, everybody. Happy Friday to you. The Early Learning and Care Division has released Management Bulletin 2020 titled Non-COVID-19 Emergency Closure Requests for Fiscal Year 2020-2021. This Management Bulletin supersedes and rescinds Management Bulletin 1009, which was previously used to request an emergency closure. Management Bulletin 2020 is applicable during fiscal year 2020-21 only as it is specific to requesting an emergency closure during COVID-19 operations. Normally, direct service contractors are reimbursed using the lesser of the contract maximum reimbursable amount, the MRA, the net reimbursable program costs, or a calculation applied to attendance. In fiscal year 2020-21, Senate Bill 820 changed the way programs are reimbursed this year due to COVID-19, including COVID-19 related program closures. However, there still exists the possibility that contracting agencies may be unable to operate their program for other reasons beyond their control, such as fires, earthquakes, floods, building issues, etc. Education Code Section 8271 states that these programs shall not be penalized for incurred program expenses, nor in subsequent annual budget allocations during these emergency closures. I'm going to get the next slide, please. In fiscal year 2020-21, if a program has a reduction to their days of operation due to a non-COVID-19 related emergency, reimbursement to that contractor may be negatively affected. A contractor will only have a reduction in the days of operation if no children were served in a contract type on a given day. Or, in other words, if one child was served in a contract type, then that contractor can claim a day of operation for that contract type. So a contractor will only need to submit a non-COVID-19 emergency closure request if all their sites and or all their classrooms were closed due to a non-COVID-19 emergency in a particular contract. If this is the case, and the contractor has had to reduce their days of operation, they can now submit a simplified form to request a credit for the lost days of operation. This form is part of Management Bulletin 2020 and has been simplified by eliminating the need to submit attendance reporting and by allowing an authorized contract representative to sign the request. Just as a reminder, an authorized contract representative is someone who has the authority to enter into contracts with the California Department of Education. Under highly unusual circumstances, an alternative payment program, AP program, or a family child care home education network program, FETCHN program, may have their reimbursement affected by a non-COVID-19 emergency event. If this is the case, the contractor should contact their assigned program quality implementation regional consultant to discuss the event and its effects on program operations. Please note that Management Bulletin 2020 does not impact or make any changes to how AP programs or FETCHN programs reimburse providers in their programs. If you have any additional questions about non-COVID-19 emergency closure requests for fiscal year 2020-2021, please contact your assigned program quality implementation regional consultant. Thanks.
Hello, this is Roseanne Pitts. I'm an administrator with the Program Quality Implementation Office. Happy to be here with all of you today. I just wanted to provide a reminder that our webinar Wednesdays that we have spoke about in previous webinars will begin next week. These trainings will provide more guidance and direction on a number of different topic areas. Next week, the training will be on certification, recertification, and notice of action in a virtual environment. The earlier workshop on Wednesday will be from 10 to 1 and will be for our direct service providers. The afternoon time from 1 to 4 will be on the same topic, but for alternative payment providers. We look forward to having everyone participate, and we're excited to kick off our webinar Wednesdays. On Tuesday of this week, we presented a workshop for agencies who are scheduled to have reviews this year. This workshop was by invitation only for our review, based on our review schedule, and focused on how we will be doing reviews this year only. Unfortunately, our line for this workshop was capped at 500 and more individuals were trying to get in. So we are scheduling another training, again, that will be on the same topic of getting ready for a review this year. And will still be by invitation only. And we're not doing this to be exclusive. We want to invite everyone, but because we're using a different approach this year, it's only going to apply to those agencies who are being reviewed this year. So this workshop, the repeat of the Tuesday workshop, is tentatively scheduled for December 2nd, and you will be getting something about that date. Thank you so much for your participation. We are happy we're able to provide the trainings for you, and we enjoy having you there asking questions and clarifying the information to the field. So now I'm going to turn it over to Alan, who will discuss some fiscal updates.
Thank you, Roseanne. As Roseanne stated, my name is Alan Lynch, and I am a manager in the Child Development and Nutrition Fiscal Services Office, or CDNFS. I am here today to present some fiscal updates from our office. So last week, Stephen Profiter provided an update on the status of the Proposition 64 CCTR expansion funding. As he mentioned then, it has been a long road, and the team at CDE has been working very hard to push through an interagency agreement with the Department of Health Care Services, DHCS, and has been in frequent contact with the Department of Finance, DOF, and the State Controller's Office, SCO. We have recently been informed that DHCS has provided all necessary documentation to the SCO, and we are now simply awaiting a fund transfer, which we expect to occur any day now. I will also reiterate what Stephen stated last week in regards to providing care before an executed contract is in place. We strongly discourage this as it puts the contractor at financial risk. While it is true that these funds were delayed due to the interagency agreement, there can be other unanticipated delays as the CDE works with individual awardees to obtain necessary documentation. Any and all delays, regardless of the reasoning, puts the contractor at financial risk. We therefore do not advise programs to begin providing care or incurring costs prior to having a contract in place. Fiscal analysts from CDNFS have been in contact with all contractors who received an award letter. The fiscal analyst should be providing details of what to expect when contracting with the California Department of Education, the next steps, and the process that is required to get the funding into a contract. These next steps may include providing a copy of the site license. Funds are never put into contract without a license being obtained unless the contractor is a local education agency, or LEA, who is exempt from licensure. Another step may be submitting a revised program calendar that reflects the dates you provided services to children in fiscal year 2020 and 21. CDNFS analysts will work with each contractor to determine the appropriate amount of funding to be placed into contract this year. We will take into consideration the date in which contractors will begin to provide care to children, whether or not all sites have licenses, and whether or not the contractor requires startup funding. Note that while CCTR expansion funding has an effective date of July 1, 2020, that does not mean that each contractor will be funded as if they were open on July 1, 2020. In other words, the awarded amount may be prorated based on when you are ready to provide care to subsidized children. The factors I just described will be taken into account when the funding amount is determined. Rest assured, we will work with each individual contractor to determine the appropriate amount of funding prior to finalizing the contract amount. If expansion contractors have questions about their specific case, they should reach out to their fiscal analyst to check the status of their documentation and what else they need to provide in order for a contract or amendment to be issued. Now, Alana will get into the question and answer portion of our webinar.
Hello again, everyone. So the moment you've all been waiting for, but before we begin the live question and answer portion of the webinar, I would like to bring up a few FAQs that have recently been posted, and I want to share some helpful hints for getting expedited answers to your questions. Next slide, please. Oh, thanks, Eric. So first, when submitting a question via email, either to the ELCD emergency inbox or to your consultants, don't forget to include the following: what county you're writing from or counties, the contract type your question applies to, your contact information. Should we just be responding to the person emailing, or is there an eligibility specialist that needs a response sooner? Also, sometimes we receive emails that have the name of the program attached to the email, and sometimes we just have a Yahoo account. So it's helpful to actually know a little bit more information. Also, if there's any special considerations, For example, is this regarding a special education student, or have you had previous contact with a fiscal analyst in a different office or division? Paint us a bigger picture so that we can be more responsive and really understand the robustness of what you're needing. Next slide, please. Thanks. So here are the types of questions that we've uploaded onto our FAQ page. Distance learning. So requirements for to provide distance learning when temporarily closed to COVID-19, reimbursements when providing both distance learning and in-person services, family fees, what to do when a family chooses to shelter in place, delinquent family fees, alternative payment provider stipends, who is eligible for those stipends, how is it calculated, closures. Are students considered absence when the site is closed due to COVID-19? What about cleaning schedules? Reopening. Direct service contractors operating on a LEA campus, and some questions regarding that. Funding. Is it linked to attendance this year? What about if we have a revision of calendar dates and new contracts to send out? And also, to let you in on our process, our FAQ team has been reviewing those questions already posted since we began our fiscal year in July, and to see what is no longer relevant, or if the information provided now has updated information. So with that, now let's answer some of your live questions. So I'm going to begin with those questions that are still open. So there are some questions regarding mandates and guidance involving the ERS, or the environmental rating scales. Can I ask Roseanne to come and speak to the program quality pieces, you know, like the parent survey, the ECHRs, the FECHRs, things of that sort?
Hello. Yes, we are still in the process of getting that program quality management bulletin out. It went out for stakeholder feedback, and that feedback came in, I believe, was due in by last night. So hopefully that management bulletin will be out very soon. What I can tell you is that the program self-evaluation will still be due this year as a time for you to evaluate your program, whether you provided services in person or via distance learning. Really is a time to look at your program and determine what has been successful and what are things that you might want to do differently with the upcoming year. So more information will be available soon per the new management bulletin that will be out.
Excellent. Thank you, Roseanne. So we do have some questions around CSPP half-day programs. And I think this is also going to involve some distance learning. So I'm going to ask Roseanne if you continue to stay on, and I'll read off the question. So we have a CSPP half-day program. If a child leaves the program because the parent had decided to pull them out, can we enroll a new student to take that spot? We offered remote services to the child pulled out, but the parent said they were going to try something different. In this case, can we disenroll and fill the spot with another CSPP student? So I'd ask that Roseanne start, and perhaps Virginia can also attach into.
Sure. If you have a parent who wants to disenroll a child, you would provide a notice of action to that family to disenroll, and of course would give them the required appeal time to maybe change their decision. After the appeal time is up, you are free to fill that slot with another child.
Excellent. And Virginia, can you speak a bit more about the disenrollment spot again, just for clarification?
I'm sorry, I'm muted. Disenrollment specific to which piece? Because there are a lot of different fronts that we're talking about that on.
Right. So Roseanne answered the question regarding CSPP half day and should we disenroll and fill the spot with another CSPP student. So I was asking if you could just reiterate about not disenrolling overarching versus, yes.
Okay, I'll give a rundown on all the different ways we're telling people not to
thanks.
disenroll. So on the slide earlier, we talked about the 110 million and that there's money coming down the pike that we're still working on receiving at CDE and then issuing out, obviously, once we get it to the field, that will address over earnings in contracts like our California Alternative Payment Program contract, where there have been higher than expected costs due to school-age children needing care for longer hours. So for that, and we also know that for some of our AP contractors that it's been difficult because there are children in emergency childcare and navigating how long you can extend the emergency childcare while there are higher costs due to school-age children has been difficult. And so these 110 million are intended to address some of those issues as well as the issues around family fees. And so we're really asking folks if they're in the situation where they're worried about over-earning their contract because of these issues, please, please, please do not disenroll families. Please work with your fiscal analyst and with your program quality implementation regional consultant if you have specific questions. But there are these additional resources coming down the pike, so that's why we're telling you not to disenroll. One of the other main areas where we're asking folks not to disenroll is on TK children, TK and kindergarten eligible children that in a normal year would have just gone on to TK and kindergarten, but for whatever reason really want to stay in our California State Preschool program. So we have some interim guidance on that we've been sharing at our webinars. We're working on longer term guidance, so I'll just repeat that because I know that we had some questions in the Q&A about that too. So first of all, for that, please do not enroll any additional children that are TK or kindergarten age eligible. So that means having a birthday between September 2nd and December 2nd for your TK eligible children, and then your kindergarten kids are going to be older than that. Please do not enroll any additional of those children in the California State Preschool program. For kids that are in that age range that are TK or kindergarten age eligible that may already be enrolled, we're encouraging a couple things. So first of all, if it's possible to transition those kids into transitional kindergarten or kindergarten, we're encouraging that to happen. If there's space in a CCTR contract, or another type of subsidized contract that supports subsidized early learning and care for that family as a school-age child, please, we encourage contractors to help transition those children into say, CCTR, for example. However, we know that not every contractor that has CSPP has CCTR, and not everyone that has CCTR has space available in their CCTR contract. So while we work out some of the complications with our guidance, we're asking you to please not disenroll or recertify these families that you're currently serving in your TK or in your, that you're currently serving in your CSPP that are TK or kindergarten age eligible. Did I miss anything that we were trying to get at, Alana?
No, you gave all that and more. Appreciate it. Okay. Before we answer another question, I just wanted to give a shout out to a comment here. So there was a provider saying that we've been open since the start of the pandemic with no fully closed days so far. And that's just amazing because we're all here for the kids. And to also hear that that program is being able to work in such extraordinary times is amazing. So thank you for sharing that, Julie. Let's see the next space. So there is a question from Kathy at 1026, which kind of spoke to what Virginia was speaking to. So Kathy, if there's any more information that you're asking because your question asked that there's a mixed message to direct not providing care, knowing if you have funds to did not enroll. If what Virginia spoke about is not clear enough, please let us know. We have the gift of time today. So there's a few people asking again to hear about the ERS requirements and also about how to sign up for the PQI's webinar Wednesday. So can I ask Roseanne to come back and again speak about the ERS requirements for this year and the program quality MB, and then also how to sign up for the weekly webinars.
Coming, just having trouble finding me unmute. I just put the link in the chat in answer to someone's questions about where to find the information about the webinar Wednesdays. It went out to the field, I believe November 8th or 9th. And there was a list of Wednesday webinars. There is no need to pre-register for those webinars. You can just log in and show up just like these webinars on Friday. So the information is in the link. You can also find it on our website, and we would be happy to have you there. I know there's a lot of questions about the different ERS requirements. Obviously, if you are not doing in-person services right now, you are not going to be able to complete an ERS. If you are doing in-person services, we would still like you to complete an ERS. And I believe all that information is going to be in the management bulletin as soon as it comes out. But I'll tell you that it's very important this year that you score very high in the area of personal care routines. For a long time, we've been talking about hand washing for 20 seconds with ERS, and people have hated that part of ERS and they haven't done well. And now in a time of COVID, that is the requirement for all. So we are training our children early, and we're excited about the fact that hopefully they will have better hand washing methods as they get older because of our ERS requirements. We do realize that some of the other areas of the ERS might score lower this year because of the way we're conducting our classrooms to keep it safe for all. So we're going to ask you to do the best you can when it comes to evaluating your own program. There will not be outside ERS assessments completed this year. Does that help? Hopefully.
That sounds crystal clear to me, but thank you, Roseanne. And do take a look at the MB when it gets released. We're very close to having that release, so please keep a hold of taking a look at the email and seeing when it's will be distributed out. I also really appreciate you saying about the 20 seconds as well. I do remember being a classroom teacher and working with students on singing songs in order to make sure that they did 20 seconds. Okay, so the next question, I'm going to ask Virginia to speak. It's about the family fees schedule. So please clarify the family fee schedule. It's listed as the maximum income for a family as $7,244, while MB 2012 states the maximum income as $6,175. This is confusing to contractors who use the family fee schedule and certify without certification software to prompt them that the family is over income.
So first of all, thanks, Shannon, for your question. This is not a COVID specific thing, but this has come up a lot. So I wanted to take the opportunity to clarify. So when you're using the family fee schedule, it's important to really read the numbers. So I want to just say the family fee schedule previously sort of capped out at 85% of SMI. However, with the change in our CSPP rules to allow more families who are over income to receive services if they live in very low income areas where they're operating in the attendance boundaries of a school that has 80% or more of children eligible for free and reduced price meals. We really wanted to take a look at how we were doing the family fee schedule. And so we looked at our data, and our data told us that there were children that were being served up to 100% of state median income in state preschool because of various things like the new eligibility rules and other sort of provisions. And so the family fee schedule this year actually goes up to 100% of SMI, so that families that are being certified not on the basis of income are having a fee that is commensurate with their income. We didn't think it was fair to have families that were earning significantly more pay the same as families that were earning 85% of the state median income. So that's why the family fee schedule, the top rank of the fees is different this year. So when you're using that fee schedule, you'll really want to like read it carefully. I think a lot of folks just assume that the top line was 85% of SMI, and what you'll really need to do is compare the fee schedule to the family's actual income to figure out where on that schedule they're landing. So I hope that helped answer your question, and if you have more follow-up, just put it in the Q&A.
Thank you. Okay. And I will ask Roseanne to speak on this one, though I think I might have already know the answer. So is the this is a word that's really hard for me, attestation form only used for AP program signatures?
I believe that is true. I believe that is true. Yes. We talked about it at our meeting yesterday. I'm not familiar with this form, as I'm not as familiar with the AP programs, but I believe that is true, that it's only for AP programs.
I would concur. Thank you, Roseanne. Okay, I have a question about distance learning. So Roseanne, I'm going to ask you again. Is it okay for part-day preschool to only offer distance learning the minimum of 1 day per week now that we are opening again for in-person learning?
Yes. Agencies are able to determine their own distance learning plan. So when you write your plan, you decide what that's going to be and you follow your plan. As long as the children are engaged in activities, you should be doing fine. And a one-size approach does not fit all. So make sure you're looking at the needs of your children when you determine your plan.
Absolutely. So I have a question I'm going to ask either Corey, Andrea, or Alan for this one. So it's about the provider closed for COVID exposure and testing positive. Are the 14 additional non-operation days reimbursed based on days of operation?
Hi, Alana. This is Andrea. Based on days of operation. So I don't know if I'm clear on the question, to be honest. So the 14 non-operational days, I think we're talking about AP programs where the primary provider has closed and a secondary provider has the child for up to 14 days. So the reimbursement, if that's what we're talking about, the reimbursement is still as you would typically reimburse a provider. So whatever that provider would receive, for that provider payment for reimbursement, there is no change in that. So it's what you would typically reimburse that that provider that now has the child in care.
Okay, thank you, Andrea. I'm going to ask Rob to come and speak. So there is someone who just wanted a clarification about children who are TK and K eligible in the CSVP program. And they're saying, so CDMIS told me to remove the children from the 801A report until further notice. Is that correct?
Thanks, Alana. That is correct. So we're asking agencies to continue to submit their 801A reports. And in order for that to occur, there can't be any errors included within the report that's uploaded or submitted. And any TK children that might still be included in the 801A report will generate an error. So in order for the 801A report to be successfully submitted, please remove all of those TK 5-year-old CSPP children from the report and include all other children and families from CSPP and or other program types on the 801A report.
Excellent, thank you. So I had a question, and I'm going to ask Rich to come back, who gave a presentation about the non-COVID emergency closures, and I guess the difference between the non-COVID closure emergency versus the closures for those with having to do with COVID. So the question is, so we had a child test in our program test positive, so we've had to close our program for 14 days. Are they considered excused absences? Do you have to fill anything extra out? Do I claim those 10 days of enrollment?
Yeah, thanks, Alana. There is a difference, a distinct difference between non-COVID-19 emergency closures and closures for COVID-19. And I need to check in with the team about how we want to report the closures for in-person attendance when a site or a classroom has to close temporarily for a COVID-related emergency closure. I can tell you for the non-COVID, again, it's only going to affect the program if they have to close all of their classrooms, because then they will not be able to claim a day of operation. But for the COVID-related closures that are going to come because maybe a teacher gets sick or a child is sick in the classroom, I will need to defer to the team to figure out how we would then want to report those to on the fiscal reporting forms.
So for a classroom that has been closed for COVID and how to report it on the fiscal form, perhaps we can have Andrea come back and address that.
Sorry, it's taking me a minute to unmute. I'm actually going to need help with Corey on that one.
Oh, sure.
So it's how to report a non-COVID closure on fiscal and attendance reports, correct?
Yes.
Okay.
So a non-COVID closure, if you were closed due to an emergency closure, let's say, for example, PG&E shut off or something, and therefore you could not open and serve children, you therefore would not be able to report the days of attendance or days of operation for that day. You will, however, once you submit that emergency closure request to ELCD, you should receive a letter, an approval letter that allows you to report the days related to the closure. So days of attendance and days of operation related to that day of closure. So at the time, that does not mean that you just wait until you get that letter, because that letter, that approval letter, could take some time. If you need, if funding terms and conditions require that you submit a monthly or quarterly report, you will do so based on the normal deadlines. but you will omit any days associated with that emergency closure. So any days of operation and any days of attendance associated with that closure. Once you get that approval letter, that then allows you to revise that month's report. You can then add the days of attendance and days of operation that are stated on the letter to whatever you had previously submitted. And then you're going to want to keep that letter on file because that becomes your supporting documentation for reimbursement.
Okay, thank you, Corey. Appreciate that. I'm also going to ask Virginia to come back and speak about the family fees because with the Q&A, I'm seeing there's a little bit of confusion.
Yeah, so I want to clarify the 110 million. So SB 820 said that family fees were waived for all families for July and August. And then it said that starting in September, family fees are only waived for families that are not receiving in-person care because, for example, they're sheltering in place or that kind of thing, doing distance learning. So that continues to be the case. Those family fees continue to only be waived for families that are not receiving in-person care. We described how that process works in one of our management bulletin, on family fees. The change with the 110 million is that there was a provision in SB 820 that said, if federal funds do not become available, providers will have to absorb the cost of these fee waivers. So for example, if a family, normally paid a $30 fee and that went to the provider, and now this family is sheltering in place for a month and there is no fee, then the provider would have to absorb that $30. So the language in SB 820 said if there are more federal funds, that will pay for these waivers, but in the absence of federal funds, providers will have to absorb. The 110 million, or really the 30 million out of the 110 million that I talked about to address family fees, is really to address the question of providers absorbing the fees. So it's not waiving the same families that have waived fees pursuant to our guidance, those same families still have the fees waived. There are no additional families that have their fees waived beyond what we've already discussed. But this addresses how the fee waiver is administered on the side of the provider. So I hope that helps.
I think that clarity is also providers and contractors, right, Virginia? Yes, okay. And
yeah,
also,
so providers, contractors that are actually providing the services themselves would no longer have to absorb, once we're able to issue the 110 million.
Okay, and Virginia, can I ask you to speak again? I know I keep calling on you. So there seems to be some miscommunication about CSPP and TK, how it's parental choice, but it's currently not parental choice anymore in certain. So if you could just speak to that. I know that we're getting low on time.
Let me clarify. So it is correct that TK is a parental choice, meaning that parents can choose to send their kids to TK or not. It's not like first grade, for example, where the kids need to be in school. Both TK and kindergarten are parental choices in California, although typically most parents send their kids to kindergarten. The piece that is maybe creating confusion is, yes, it is true that a parent can choose or choose not to send their kids to TK or K. However, there was a change in law. First of all, however, kindergarten age children have never been able to attend CSPP. So you can choose not to attend kindergarten, but you've never been able to just choose to attend CSPP instead, because CSPP has always been for 3 and 4-year-olds. Up until a year and a half ago, the law was written in a way that allowed families to choose between TK and CSPP. However, that law changed. And those changes were implemented in your funding terms and conditions. So the situation that we're now in is that normally we'd have less of a challenge because our TK age children would have, and our kindergarten age children who are enrolled in CFPP the previous year would have transferred over to their TK programs or their kindergarten programs. But we know a lot of those programs are not in person. So this is coming up, you know, we're getting a lot of questions about, okay, well, we know that we can't enroll any additional children that are this age in CFPP because that is against what the statutory definitions of CFPP are and against what's in our funding terms and conditions and program requirements. However, these kids were enrolled last year, so what about 12-month eligibility? And so that's what we're working on guidance for. Our guidance is really focused on, okay, knowing that there are some kids that were enrolled last time around, you know, that they do sort of have those protections. So what guidance should we be issuing? And that's something that we're working on there. So I hope that has clarified the questions. And Alana can tell me if there's any more follow-up there or if there's anything I missed.
I think that was good. Thank you very much. I'm going to ask that Eric move the slide, and I'm going to do everyone's favorite thing, which is read a bunch of websites while our team gets to answering the open questions that are still here. So give us a moment. So some common resources that we have available for you. If you'd like to see any webinar slides, management bulletins, FAQs, those can be found on ELCD COVID-19 guidance webpage at https://www.cde.gov/CD/RE/ELCD COVID-19.ASP. Thank you, Mai. You may also submit additional questions to ELCD Emergency Inbox at elcdemergency@cde.ca.gov. And just to reiterate what I spoke about earlier, please make sure that there's a full name and contact for your program. There is what contract your program is with, what county your program is with, and any other considerations so that we can get you an expedited answer. To contact your assigned PQI Office Regional Consultant, a list of those consultants can be found on ELCD Consultant Regional Assignments webpage at https://www.cde.ca.gov/sp/cd/ci/assignments.asp. Consultants are most easily reached by email. And still you prefer to use the phone, you can contact them at 916-322-6233. Next slide, please. And also, since we have our friend Madison here, to contact your child and adult care food program county analyst, a list can be found at https://www.cde.ga.gov/li/cc/cacfp contact.asp. Next slide, please. Oh, what a picture. I love that. So I'd like to invite our fearless leaders back to help us close out this webinar today.
Thank you, Ms. Alana. On behalf of Early Learning and Care Divisions and CDE staff, I want to thank you again for participating. I want to also thank the webinar team, those in front and behind the scenes. As we continue to adjust and adapt to our current reality, we hope that you all and all of us will continue to take care of ourselves and others by wearing masks, physical distance, and wash our hands, all in accordance with recommendations of health professionals. Thank you and stay safe. Now on to you, Steve.
Thanks, Erica. Yeah, so just to echo what Erica said, thank you for taking time out of your day to join us for this morning's webinar. We'd like to close by asking all of us to take care, be safe, and be kind. And also add on that we all need to work together to stop the spread of the coronavirus. You hear it from public health departments and public health officials, but please wear a face covering, especially as we're, when you're in public, especially as we're heading into flu season. I mean, I mentioned last week that it looked like the state was moving in a better direction than other parts of the country. And then we saw a number of counties moving into a higher risk tier this week. So there's still plenty of work in front of us, particularly if we want to avoid more shutdowns and more impact. So our collective efforts to wear a mask and practice good hygiene, as Erica described, will help to stop the spread of the coronavirus. With your continued efforts, we'll get through this together. Thank you for joining us again. Be well and have a great weekend.